Gunnar Esiason, and you are listening to Breathe In, a cystic fibrosis podcast presented by the Boomer Esiason Foundation and GunnarEsiason.com. This podcast series has been made possible by Vertex, Novartis, DCU, and Atlantic Health. The views expressed on Breathe In, a cystic fibrosis podcast are that of Gunnar Esiason, Leah Ferrone, Tiffany Rich, and guests, and are not necessarily those of the Boomer Esiason Foundation. Nothing in this podcast series should be considered medical advice. Such advice can only be given by a physician who's experienced with cystic fibrosis. The Boomer Esiason Foundation, Gunnar Esiason, Leah Ferrone, Tiffany Rich, and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to Breathe In, a cystic fibrosis podcast. All right, it's Gunnar Esiason back for another episode of Breathe In with my lovely co-hosts, Leah and Tiffany. How are you guys?
Good, how are you doing?
How are you?
I am well. It is the final week of Cystic Fibrosis Awareness Month. We are here for it.
Yes, it is.
And with that, summer is also here. We have Memorial Day coming up this weekend. Are you guys doing anything exciting for Memorial Day weekend?
I'm going to Bottle Rock, which is in Napa, and it's a big festival, music festival. And Bruno Mars is headlining it the day I'm going.
Oh, that's cool.
So I'm super excited because I've never seen him, and I felt like this was probably the cheapest way to see him. And then Halsey is there too, and some other people. So I'm pretty excited. It'll be fun.
Man, you're all about the concerts, aren't you?
I am. I love music. Music's like good therapy, I think.
It definitely is good therapy. But
it is,
I have an unpopular opinion for you. Bruno Mars sucks. He is horrendous.
No. I
feel like both of you are on really extreme ends with just your musical tastes. Like Tiff is all one way, you're all the other, and I'm just in the middle. You know?
But I like some of his stuff, and he probably does like some of the stuff I like. But yeah,
I like
for sure.
Older stuff, the newer stuff.
Yeah,
that's how I feel.
I mean, lately you're listening to show tunes from the 40s. Is that what you're into?
Yeah. No. I think I have a very broad taste in music. I like a little bit of everything.
But I did send Gunnar a video of Taylor Swift singing "We're Never Ever Getting Back Together."
Yeah.
And I sent him that
because
I knew he loved that Taylor, so I was like, "This is for you."
Yeah, she did. All right, so today's episode, we're going to do a mailbag. We've done one before where a bunch of our listeners ask questions, and then we'll just kind of rapid-fire go through them. Today's questions are kind of all over the place, but really specifically speaking, we are going to go over a couple questions for Leah, because Leah's got a number of questions about working in the healthcare industry as being a nurse on the front lines of the health world.
Yeah.
So we will get to those in a minute, but first we're going to start out with this one. We'll start with a lighthearted one, okay?
Okay.
Okay, wait.
This one is, how do you explain to a new boyfriend or girlfriend or a new person of interest that you have some GI distress, whether that's irregular bowel movements or irregular farting habits? How do you approach that topic?
Oh.
Well, I feel like, at least with my current boyfriend, it wasn't necessarily I approached the topic. It was, we're sitting there, I'm laughing really hard, and I just start farting. And then you kind of tackle that topic.
Right.
I do that. I laugh really hard, and then I cough. And it's just oh, well, it's a lost cause.
You fart when you cough? Or when you laugh?
Yeah, I cough really hard.
It's a lot of pressure.
Really hard. I fart. I can't help it.
It's a pressure on your
It's too much pressure. Yeah.
Yeah,
so
it happens.
I was the first person to fart in the relationship.
And when you sneeze too, it can happen.
You fart when you sneeze?
I don't do that. I've never done that.
I have never done that either.
Really? Oh, okay. Well, I'm weird.
So that's how I tackle that topic. It just happens.
Well, I think Jeff knew that CF was a digestive disease as well. So, when I need to go to the bathroom and I really need to go, he's just go. He understood. So I think just explaining that it's a digestive issue as well.
Yeah.
Then the mucus coming out is stuff going on down in that region too.
Yeah, it just has to happen. I mean, because you can't.
Yeah.
You're not like
natural.
We're not like normal. We're not like the normals who can hold their farts. It just gotta come out.
It's just gotta rip.
It actually has to, like, you just have to let it rip. And I think over time, it at first it's funny, and then it becomes like a normal thing, and then it continues to be funny like it is right now.
Yeah. Exactly. I mean, we like both have days where we just start laughing at it, you know, like
it's funny,
but it becomes normal. Yeah.
I had to say the other day I tried to tweak something with my feeding tube formula overnight, and I tried to add a little protein to it. I was like, I'm in the gym that kind of year. It's like it's bulking season. Protein. Exactly. So I put some protein in the feeding tube formula.
Bad idea.
And I woke up like in the middle of the night because I farted myself awake.
That's the best.
That's so funny.
I woke up and I was like, "What is that smell?"
That had to have been horrendous. I can't even.
Oh my god! My body declared chemical warfare on myself. I was like,
"Oh my god,
never again!"
It was horrendous, and I was like,
"Don't do that."
I was like, maybe
a little too much protein there for that GI tract.
Definitely a little too much protein in the feeding tube. So I've since gone back to my normal feeds.
Good idea.
But I think our tip to our listener here is that it just is going to happen, and there's no hiding it. And it's a normal bodily function. I remember when I was like a little kid in grade school, it was something you try to hide or whatever. But then as I got older, you just embrace it, and that's just
everybody.
That's what it is. That's what it is. It's just a normal function. All right. Okay. So let's get a little more serious now. How do you get over days when you're feeling guilty for being sick? Basically not being able to get things done or you're missing out. And this one comes from the DMs on Instagram from @thatgirlwithcf. So how do you guys get over days of feeling guilty or missing out? And what do you do to cope with that?
This is a tough question because I do struggle with this.
I struggle with this one too.
Yeah, I mean, I think it's very natural to have days where you're just going to feel guilty. I know I have them every so often, and I just kind of start apologizing to all these people in my life. I'm sorry I can't breathe. I'm sorry I can't do this. And I think just having them there and reminding me it's okay. It's not your fault. It is what it is. That kind of just helps me get through that. Just having other people in my life that just remind me that it's okay to feel that way, but I don't need to feel that way, and I shouldn't feel that way. I think that's kind of what gets me through that.
I agree. Yeah. I agree because when I was super sick, I couldn't do a lot. So having them be we'll do it when you have new lungs and you can breathe. This can always happen again. We can do it on a better day or whatever. So I think that's really way to cope too, is just getting their feedback and saying it's okay.
Yeah, I agree with you guys. I think it hits me most is when I can't do something work related. Oddly enough, I mean, social world, I kind of
no. I have that problem too.
I wouldn't say that I expect my friends to always be, willing to give, in certain cases. But I think work is just a little different because it's a different kind of responsibility. I think back actually to this winter, and I had a speaking engagement that I was supposed to do in Tampa Bay for a CF Family Day at the hospital there, and I ended up getting sick the week before, and I was on IVs, and it just the day came closer, I was like, I'm just not getting better. My sort of plan was to maybe feel better after a couple days of IVs and then fly down with the IV, which I've done before and it's no problem. But as the days went on and I got closer and closer to the event, it just came down to the point where I was like, I'm not going to be able to make this trip. Yeah. And I felt horrible by not being able to go and live up to my promise and my work commitment. But the center ended up making it work. I Skyped in like we're doing right now. I Skyped into the CF Family Day and did it that way. But still, it was not the same thing. And obviously, that's the kind of situation where I think people would probably understand because it's the CF world. But still,
Right.
as a a working person, who's someone who thinks of himself as someone who's healthy enough to work and have all these responsibilities and be okay about it.
Yeah.
It was
Right.
it was definitely difficult to sort of come to the realization that, okay, I have to take a step back and worry about me before I can go down and fulfill my commitment.
Yeah.
Yeah.
Right.
I'm
And
glad.
I think lately I've had a lot of those struggles in terms of my work situation, and just,
Yeah.
being a nurse is it's a very physical job. It's not, sedentary like a lot of other jobs. So I'm on my feet, and if I don't feel well, or if I'm going through a period of time where I need IVs or something like that, I try my best to always be there and be working, but some days you just got to step back and take care of yourself.
Yeah.
And you feel guilty because it's like, I have all these other people depending on me. But, if I'm not healthy and I'm not going to overcome this, then I'm not going to be able to be there for them majority of the time. So, and I think, like, as I've gotten older, I've gotten more open with my family and my boyfriend and my friends about, feeling like that. So a lot of times when, even if it's work related, I'll just start venting to one of them about just how guilty I feel.
Yeah.
And, like, again, they really help pull me out of that, because it can be like a vicious cycle of just kind of like dragging yourself down, for something that really isn't in your control.
Yeah, definitely.
So,
I mean, I also run into this issue with coaching ice hockey because, I'm on my feet every single day of the week, coaching hockey, working with kids. And that's one of the things where, like, I am directly responsible for the entire program by virtue of being the head coach. Like, it's something that I have accepted the responsibility that it is difficult sometimes when I'm not feeling well. And in that case, it's nice to have, like, a support system available. Like, I have my assistant coach who knows what I'm dealing with and is willing to step in if I'm not feeling well.
Yeah.
Right.
And then
That's really nice.
And the school is also able to support me in those days too. I mean, I'm an alum of the school, so they know that I'm dealing with CF, and they're able to work with me and stuff like that.
Right.
But there's definitely days when I'm not feeling well, where practice will come around, and I have to be on my skates, and I have to be moving around. Where the assistant coach will do all the legwork, and I'll kind of just stand there and oversee practice, where it's a little bit less legwork for me. So I think it's important to have mechanisms in place so that you can fall back to. Like me, I had to do the Skype presentation. I have an assistant coach at ice hockey.
Right.
There's different fallback scenarios that I think I've been able to work with.
Exactly. I mean, even when it comes to nursing, I mean, I've kind of worked out situations where, let's say I'm on IVs for a couple of weeks, and my first week, I'm not able to be on my feet. I can at least be at work and put IVs in for other nurses and do a lot of the documenting and the things that aren't as physically taxing. And I'm lucky that I do have other nurses that are understanding of what I'm going through, and we kind of work out a routine that works for everyone. So I think you just have to get creative, when you are in those situations.
And you need to have coworkers that are willing to be able to be supportive. And not every place of work will have that. It's all about finding a place of work that can support you both physically and financially and as far as your career goes.
Right.
All right, so since we're on sort of your nursing career right now, Leah, let's talk about some of these questions that we've gotten that have asked specifically about you working as a nurse in the healthcare field. Obviously, it's a bit unique because you have CF, and it's there are some concerns about your health in working in the nursing field. So the first question is, how do you keep yourself healthy in the nursing world?
So I think a lot of it comes down to selecting the right job. I get a lot of questions about, exposing myself to all of these germs and different infections, like, different infections that CFers get. And to be honest, I chose a job that would not put me at risk. That was 100% my goal. I can't be a nurse if I don't have my health. So if I didn't have CF, I would be working in some ICU with really sick babies or really sick kids. I think kids are just way too germy, so I eliminated all pediatric jobs from my when I went to apply for jobs. I just was saying, I'm working with adults, I'm eliminating that factor. Then it came to, okay, I can't do a rotating shift, and I can't do 12-hour shifts. I've done them before. They don't work for my treatment routine. They don't work for keeping myself healthy. So I needed constant day shift. I needed something that, I could keep up with that routine and have the same routine every single day. So I only work about 8 hours at a time. Lately, it's been about 10 hours, which is pushing it. But
As you cough.
I think those are my two. I know, right? I cough. I can't help it.
Yeah.
I have CF. Surprise.
Right.
But I think, selecting the right job and one that works for you and you're not putting yourself at risk. I work in an outpatient infusion clinic. So I have, relatively the same patients almost every single day. We screen our patients. We make sure they don't have any active infections because most of the patients in there, they're also immunocompromised. So we can't have someone in there that has a cold or has the flu or has any type of infection that they could give to one of those other patients. So I'm not taking care of patients that have respiratory problems. I'm not taking care of CF patients. Our hospital doesn't even treat CF. So there is no risk of coming in contact with those kind of patients. I literally walk in the front door, turn to the left, and I'm in my clinic. Like, I'm not trekking through the hospital. You know what I mean? So I think just those types of factors really eliminate, exposing myself to a lot of germs. I'm also pretty anal about washing my hands. Like, anytime I take care of a patient, I literally, leave that little section and wash my hands, So I clean everything when I come into work. I wipe down my computer. I wipe down the chair. I wipe down the mouse. I wipe down the phones. I mean, I'm very, regimented in what I do. And it seems to be a good process, and it works for me. So,
yeah.
Yeah, I mean, you make a lot of good points there, especially about avoiding CF patients. That was really the next question, is how do you avoid CF patients? And it sounds like you just don't ever come in contact with them by virtue of work.
That was one question I actually asked during my interview process, was since it was an infusion clinic, a lot of CF patients, we end up on IV antibiotics. So are we a clinic that treats CF patients? And the answer was flat out no. That our hospital system does not treat CF patients, so I would never be at risk. And if at any point we did cross that bridge and there happened to be a CF patient, I would be told right away, this is the situation, and we would make sure that I either wasn't working the days that patient was there or whatever, because we don't want to put the patient at risk. We don't want to put me at risk. Yeah. So that was a discussion I had very early on.
That sort of sounds like the safeguards we were talking about earlier.
Right, exactly. So,
I think when I go to the infusion clinic, I'm the only CF patients they see. So, and they make sure that I know, too, when I'm there. So I understand that for sure.
That's interesting.
You definitely have to be careful.
I mean, you covered a lot of the stuff that we were going to talk about, but let's, this is the last one, really, is do your patients and families get concerned when you're coughing? Like, do they think that you're sick or you're going to get them sick? Or obviously, I think about whenever I go and I'm involved in, a healthcare world, if someone's coughing, I'm, totally on alert for such a situation. So how does that work the other way?
Mm-hmm. So when it comes to the other way, I think when I first started as a nurse, it was an issue. A lot of the patients were like, oh, that sounds bad, or, oh, I had that cold a couple weeks ago, or something like that. And, I have had patients that'll come in and, I'll walk away and I'll go cough in a different area. I never cough, on a patient or when I'm really working with a patient. I always remove myself and I go do what I have to do and I wash my hands and I come back. But, I mean, I've overheard patients be like, oh, my gosh, she has the flu. I can't get the flu. Please remove me from this area. And, a lot of the nurses that I work with, they're like, I guarantee you she's not contagious, that's just her chronic cough. It's you're okay. You know what I mean?
Right.
But majority of the patients I do see on a regular basis, almost all of them know I have CF at this point. So I think I'm lucky with the nursing that I do get to build relationships with these people. I do see the same people majority of the time. I'm very close to the majority of them. They know my life story. I know their life story. So at this point, they understand. You know what I mean?
Do you feel like you build a patient relationship with them?
Oh, yeah, I definitely do. Yeah. And I do think that having CF has given me a different perspective as a nurse. Yeah. So I'm able to give better care and different care than majority of nurses would, because I've went through a majority of the things that they've went through.
Right.
So I do think it's kind of like a mutual respect and understanding for one another. And I do really appreciate that relationship because they are really supportive of me as I am of them,
Yeah. You're more of an advocate, too. Because
I definitely advocate for them.
Yeah, you do.
Way more than I probably need to.
Yeah.
But I'm, protective of all of them.
Right. It's important.
Yeah.
Because sometimes they don't know how to do that.
And a lot of them don't have people in their lives to advocate for them, I think a lot of people people fail to realize that when you really genuinely do not feel well, you don't always want to advocate for yourself, you know? So if I can make their lives a little bit easier, that's what I try to do.
Yeah.
You know? And so on my bad days, they're all super understanding. You know, they're like, well, don't go get me that until, you know, you need to go get 50 other things around the corner. You know, they know that me doing laps is not probably the best situation that I am going to cough up a lung. But, you know, it's just one of those things that I've explained to them over time. And I think they have a right to know because, you know, if I were in their shoes and I had someone taking care of me that was coughing, I would want to know. You know, I would want to know I'm not putting myself at risk. So,
yeah. Well, I always am like, I wish Leah was my nurse.
I wish I could be.
The last question here is, why did you want to become a nurse? Like, why did you want to go into nursing?
I think it really stems from just having CF. I mean, you know, we've been through so many situations in terms of the hospital. And a lot of those are good situations and a lot of those are bad situations. And I think I've learned a lot and I've had so many incredible people that have been a part of my journey with CF that I kind of wanted to be that advocate and that shoulder to lean on for other people. So that's why I think nursing really just felt like the right situation for me, you know? Cool. I just knew I had to go about it a certain way.
Well, you're good at it.
Well, we had to take her word for it because
I can put in an IV in pretty much anything.
God. All right, so we're gonna move on now to some of the other questions here. So, what are some of the goals that you are most proud of achieving? You know, either going somewhere or doing something. You know, what are you most proud of having done so far in your lives?
Well, graduating from college.
Yeah, I think that's one.
Becoming a nurse, that was another really big one. Then all of my overcoming my hemoptysis issues, that was huge, okay? And then I planned a trip to Hawaii within like 3 weeks of overcoming that. Because I was like, I'm taking advantage of this.
I'm going.
And it's far from Maryland. It's not like
it is. It's not like me.
I mean? So that was really exciting and something I was very proud of. Those are probably my top ones.
Yeah, I think definitely college transplant because that was
that's a small little thing.
Right there. You know, just a little bit. I think being able to do stuff again, just in general, just being able to not have to think about breathing and if I'm going to be able to make it down the hall or, you know, going places. Just, I think just being able to do that. And I think going to Disney World again and meeting Leah.
That was a huge one.
Yeah. And I think just being able to go there. Yeah. and Taylor Swift when I hugged her and, you know, life. Yeah. And being able to sing and dance at her concert this past, 2 weeks ago.
Yeah.
I think that was a big thing in my life, too. So those things are...
I can dance through an entire concert anymore. I don't think I could, honestly.
Oh, I was on my feet the whole night. I was jumping. I was having a blast. So I think those are big deals, you know?
They're all big deals.
Yeah.
Those are all the things definitely have a lot of pride in. For me, graduating college is probably the number one thing that I'm most proud of achieving. That was just like a goal you always have, and you know, to get the degree, it's finally it comes to fruition, and you know, all of that. Another thing that I'm super proud of, when I was in high school, when I was a junior, I made the varsity football team, and my coach before the game was, what are your goals? And I said, I just want to be able to compete like the rest of my friends at a normal level. I want to be able to throw a touchdown pass, and I did, and that was a pretty cool moment. And I think more recently, something that I'm really proud of is really just, I think, being able to get up, go to work, have have a life and do everyday things like everyone else. And I think those are all definitely things that I'm super proud of. Those are small achievements, but I think we talk about here a lot, setting small goals, short-term goals, and I think achieving short-term goals are really just as important as achieving long-term goals, because you have to use your short-term goals to end up getting to things down the road. And I think those are things that people can often overlook. And I'm certainly guilty of overlooking things in the short term. But I think when it comes down to really focusing on a handful of items and things in the short term that getting up, doing my treatments every day, taking the pills when I'm supposed to, going to clinic on time, being where I'm supposed to be on time, and going to the gym 4 times a week. Those are all things that are like short-term goals for me. And whenever I, achieve them, I feel good about myself. And whenever I don't achieve them, I use it as motivation to be better next time.
For sure. But I think the short-term goals, honestly, sometimes are even more important than the long-term, because if you don't meet those short-term goals of waking up, doing your treatments, going to the gym, you're not going to be able to do the long-term ones. So sometimes, like, the little tiny goals are really the big goals,
Yeah. And I think birthdays are a big deal, too.
I make a big deal of everyone's birthday.
I just think birthdays are an accomplishment. Like,
they are.
Especially with being a CF patient. We have that life expectancy, or whatever you want to say.
Speaking of birthdays, you just had one yourself.
What?
You just had one yourself.
I did. I turned 29.
Wow.
Guys.
Lady. I actually got her a cane.
Old lady.
You are really in your late 20s now. Like, there's no denying that you are in your late 20s.
The last year of my 20s, got to make them big.
Yes.
I got to make it big, And then it's dirty 30. Yeah. Oh,
yes,
boy.
Yes, it is. Okay, so that one cancels out. All